Well, a non-profit group in New York is fighting back over criticism. It's empowering bullying by offering free plastic surgery to victims. Now, the case that stirred the controversy in the first place is that of 15-year-old Renata, who had reconstruction on both her nose and her chin after years of taunting by classmates. She turned to the Little Babyface Foundation, which offers free surgery to children from low-income families who suffer from facial deformities. And the foundation is run by Dr. Thomas Romo, and he joins us now live from New York. Good morning, Doctor. Thank you very much for your time this morning. Now, your foundation has been helping disadvantaged kids with facial deformities for over a decade now, an incredible foundation. How do you, first of all, decide who qualifies for the surgery and who doesn't?
Well, there's a board of physicians who evaluate the children to see if they meet the criteria of a facial birth defect, and 19 different specialties. And once that's determined that as a foundation we can help them, then we procure the money from our board of directors. And then the child's brought here to New York for the free surgery.
If someone is being bullied because of the way they look, does that ever factor into your decision?
Well, not routinely, because I think it's probably, we've operated on children from very unsophisticated cultures to very sophisticated, and all of them have, to some degree, stated that they've been bullied. So I don't think it's unique, but bullying is very pervasive, and one of the stories that we get told all the time is that the children have been bullied in multiple ways and at multiple times. But it's not a criteria for operating on them.
That happened, though, for young Aster from a little village in Ethiopia. Can you tell us about that case?
Aster is a 13-year-old young woman from very deep in the countryside in Ethiopia, who was born with a small cyst, and because it could not be treated in her village, it grew to the size of a soccer ball, football, 7 pounds, and we were presented with that case. She had even been bullied in her village and had never gone to school since she was 13. We brought her to New York. It took us 9 months to get her here. We operated. We took the cyst out, which eventually would have blocked her airway and actually killed her. And she went back, and her big story is that she told us she wants to go to school and become a doctor.
Oh, how good is that? It is a brilliant idea. The foundation does such good work. How did it all get started in the first place?
The foundation was started as a response to try and take care of children who had any kind of facial birth defect, not just limited to the cleft lip and cleft palate. And in order to do that, you have to bring the children to a more sophisticated hospital setting, and then have multiple doctors be able to offer their services for free for the reconstruction.
There's always, I guess, even though the foundation does such great work, there's always criticism, and we're seeing that at the moment. Do you think we are putting too much emphasis on how people look, or is this just reality? Well,
we all know it's reality, since we know that Cleopatra was using makeup several years ago, and within popular culture, the way people look ends up have them onto popular magazines and TV shows about the way you look. So it is pervasive throughout our culture. Do we emphasize it too much as a culture? I think we do, but I'm not sure we're going to change it. As a surgical organization, our option is when we deem a child capable and have the deformity, then what we can do, and secondarily, but it does empower them, is to provide them with surgery. Do they need psychiatric, mental health and problem and support? They do. But our organization doesn't supply that. We're a surgical organization.
And doing a brilliant job at that. Dr. Thomas Romo, thank you very much for your time this morning. We do appreciate it.
Thank you, Wendy.